So we have a broad range of data covering many projects and products here at the ADA this year. We have the LEADER data, which I think was probably the most anticipated data from our perspective at least, which is the liraglutide cardiovascular outcomes trial. We also have the SWITCH data, which is SWITCH 1 and 2 in type 1 and type 2 patients, investigating head-to-head in a blinded fashion insulin degludec versus insulin glargine U100 and the risk of hypoglycemia seen with that. We also have the dual studies, which is insulin degludec and liraglutide combination in a single injection. We have ONSET, which is our faster aspart data that is now part of the filing for our 3A program. And lastly, today we presented two oral presentations on semaglutide, which is our weekly GLP-1, and that's the SUSTAIN program. Here we presented SUSTAIN 2 and SUSTAIN 3 versus sitagliptin and also Bydureon or exenatide extended duration. We have 53 abstracts, so in addition to those main data, we have quite a bit of other supportive data as well. So the SWITCH trials were designed to really confirm and in fact shore up, if you will, the data from the 3A program of Tresiba or insulin degludec versus glargine U100 to look at specifically the hypo benefit in Tresiba that we saw in the 3A program. Some of the criticism is the 3A program, the data was low-risk patients for hypoglycemia, and so therefore the numbers were somewhat low and the benefits were not enough that the FDA has them in the label. These two trials were actually designed to really address many of those concerns. They're blinded trials in an insulin vial, and after patients have started on either Tresiba or insulin glargine and they stay on that for 32 weeks, they cross over and take the other therapy. So it's a really effective way to look at those hypoglycemia rates. And in both the SWITCH 1, which is type 1 diabetes, and SWITCH 2, which is type 2, there was a benefit or a reduction in hypoglycemia seen, and this was seen in the maintenance period, which is the last 16 weeks of control where patients' doses are stable. There was a reduction in severe or blood glucose confirmed hypoglycemia versus insulin glargine for Tresiba. Also with severes throughout the whole trial, and nighttime or nocturnal hypoglycemia was also reduced. So all the endpoints were confirmed to be significant in favor of Tresiba. It was actually very robust throughout. The only difference being that type 1 patients have a higher rate of hypoglycemia, have more hypoglycemia reactions, so they tend to see a bigger benefit in number of reductions, but for both, the endpoints were very much confirmed, so either type 1 or type 2. I think any person who is at risk for hypoglycemia, certainly even one episode is a concern. So anytime you have a patient that's on insulin in particular that maybe is tightly controlled or has had challenges with hypoglycemia, this would be very, very important news or very important information for them. It's an insulin, so hypoglycemia is the #1 safety concern, so therefore we've shown that there's less hypoglycemia, but other than that, no, there were no safety considerations or new safety concerns seen, not at all. Tresiba is currently approved, so it's out there now. So hopefully it will move the field forward in understanding the risk of hypoglycemia versus the agents that are out there currently. So I think to support Tresiba's use for patients who are requiring basal insulin therapy. SUSTAIN is our program evaluating the weekly version of our GLP-1 product, semaglutide. There have been 6 trials that are going to be part of the file towards the end of this year, but at this Congress, SUSTAIN 2 and SUSTAIN 3 were presented. These evaluated the weekly injection of semaglutide versus either sitagliptin or Bydureon or Byta extended release. In both of these trials, there were significant reductions in A1C favoring semaglutide versus the comparators, as well as an improvement in the amount of weight reduction that was seen versus the comparators, and finally, very low rates of hypoglycemia. So despite the fact that patients were able to lower their A1C so significantly, they didn't see the weight gain, they didn't see the increase in hypoglycemia. So it goes a long way for the data that will be part of our full file with the FDA at the end of the year. The SUSTAIN program was evaluated to look at many different comparators throughout placebo, again all the way to sitagliptin, long-acting GLP-1, short-acting, and in fact also contains a cardiovascular outcomes trial that was top line was reported. So what we're looking at is really looking at the broad range of use for semaglutide once it would be approved in many different populations. So these studies here today go against two of the more commonly used comparators, if you will, sitagliptin and then the weekly version of exenatide. People that want a cure for type 2 diabetes are probably going to be continually disappointed that it's such a diverse disease and patients are very individual that number one, we want to give them better tools, whatever their needs are, either insulin, GLP-1, even we're working on oral versions of this. So we want to continue to improve the tools, but at this meeting I saw a greater focus on data, I saw a greater focus on earlier recognition and prevention of diabetes, and that's encouraging because that also fits with our mission of changing diabetes, that we believe if we're ever going to make a difference in type 2, we do have to start with either earlier recognition or even prevention, hitting the risk factors for type 2 diabetes, and to make a difference. Versus waiting and trying to find that magic bullet. We're going to continue to advance therapies and either more effective or safer therapies, but we're also addressing the early stages and trying to even prevent patients from having diabetes in the first place. This time next year, hopefully we'll be talking even more about semaglutide and where we're advancing with that approval. The cardiovascular outcomes trial for that is advancing, and we also have potentially 2 launched products in the Ideglira, or Zoltify is the global name, and then faster acting aspart will hopefully also be recently launched, so we'll have data to support that.